Today with Susan Moran Palmer, who's running as a Democrat in the 16th District Congressional race. How you doing?
Fine, thank you for the invitation.
Well, I'm always happy to have you around. So, Mrs. Palmer, I hear you had some good news this week on endorsements.
I did. President Obama endorsed me yesterday, only the 4th congressional race here in Ohio.
Wow. So, what does one do with those endorsements?
Well, I make a lot of phone calls saying the president just endorsed me.
Okay. Have you been able to, is he going to come in or meet for anything?
He was in 2 weeks ago for a Cordray Sutton rally at that point. I don't believe he's coming again anytime soon.
Yeah, in Cuyahoga County.
Right.
Yes. Now, the 16th District is kind of a strange district, isn't it?
It is.
Give the listeners and viewers an idea of how this district has been gerrymandered and what you have to do.
Well, it goes across 6 counties with very diverse wants and needs, which is unfortunate. So it goes from Cuyahoga almost to the lake in Westlake, where I live, all the way down through Cuyahoga on the western side, down through Summit, Medina, Stark, Portage, and then all of Wayne County.
Holy cow, that's a difficult district to run in.
Yes, disparate needs.
Okay, now what type of issues do you see that you would like to tell the voters that will be listening to this, will be voting in those areas? 16th District. This is U.S. Congress, this isn't the State House, this is U.S. Congress.
I think the thing I hear the most about is wages. You hear about the economy across the United States being so strong and the stock market being at its highest levels, and yet in Ohio, most people don't feel it. So where's the disconnect? And Ohio is still below our 2000 recession level on wages. We are a solid 10,000 under the national average for median income in Ohio.
Holy cow. So what are your prospects for getting such a change made?
Well, 2 things. First off, I think we still need to have infrastructure investment in the Ohio Valley. We are still going to be a manufacturing hub if we can find a way to bring cheap electricity to the area. Think wind farm, solar fields, structural investments we can make to make electricity cheaper in our area, which will draw manufacturers back to this base.
And you consider yourself a progressive in that area, I gather?
Well, alternative energies isn't just a progressive issue, it's a financial economic issue. As we step back from all this stuff and look backwards towards older forms of producing electricity, we're letting a lot of other countries take this technology over.
Well, in terms of creating more jobs here, what's your position on the right to work for less?
I grew up in Youngstown, so I am not a fan of right to work.
Right to work for less.
Right to work for less. Right now, unions are our last barrier to even lower wages, and Ohio's already suffering some of the lowest wages we've had in our history.
Have you been getting assistance from some of the local unions?
Yes, I am AFL-CIO endorsed for the entire state. That also pulls in United Steelworkers Union here in Canton. It pulls in, my dad's union. My dad was IUE, but now they're CWA IUE. Pipe fitters, local, plumbers, local 33. I do have a very long list of labor endorsements.
Now, I'm sure you would like to be talking to these issues in front of your opponent. So what debates have been scheduled with your opponent in the race?
He has turned down the League of Women Voters, which is a nonpartisan group. He's turned them both down in Wayne County and also in Cuyahoga County. The City Club sent out an invitation to both of us last Tuesday after we had our plain dealer endorsement meeting, and he said he'd be happy to debate. I accepted within an hour. He has still not answered. And
what do you see as the purpose of such a forum where you can actually be one-on-one with your opponent?
Neither me or my opponent have ever been elected to office. The idea of not having voters have access to us, ask us questions, hear our positions on different issues is unthinkable. They have every right to talk to us, every right to ask us questions. And for me, living in the 16th for 20 years, I think that's incredibly disrespectful to me and my neighbors.
Well, I think it is too. Anybody worth their weight should be willing to come before a public median and discuss the issues, whether it be in a debate forum or, give and take.
And unfortunately, he's only lived in the district for a year, so if your concern is how much does he know about our area, you're not going to find out.
And your background for running for Congress, what would be the most important things in your past that you see will make you a perfect and a very knowledgeable congressperson?
My background's all healthcare, but all aspects of it. So I started out putting in pacemakers and defibrillators into patients, and then I came out on the industry side, research and development, clinical research, teaching physicians how to use new equipment. And then I worked for several startup medical companies, and I owned and operated my own medical consulting firm, all here in the district. So it kind of gives you a viewpoint of every aspect of our medical system and how it works, and I've been able to compare it to other systems in other countries.
Do you have any insight that you would like to share on the Affordable Care Act, its benefits, its needs perhaps to change? It's been attacked ad nauseum for almost 8 years now. So what are your thoughts on the Affordable Care Act?
I think we are on defense right now. The most important thing about the Affordable Care Act, or Obamacare, whichever way you like to call it, is the expansion of Medicaid for Ohio. In Ohio, that's another 850,000 Ohioans that are covered, on top of the 2 million that were covered under Medicaid. So that entire population is working poor, and they don't have enough money to buy insurance. And remember, we are now the #1 state for opioid overdoses in the country. The opioid overdose deaths, we have the highest rate, and that's how they get treated, is through Medicaid.
And Medicaid provides health coverage at an affordable cost to those that wouldn't be able to afford health coverage otherwise. Is that fairly accurate?
That is, and it also is federal government money. For every dollar spent on Medicaid or Medicaid expansion, 95% comes from the federal government, 5% from Ohio. So it's also a big economic kick into the state.
What would be the cost of getting a private health care plan in today's economic climate if Medicaid is not available, or Affordable Care Act isn't available to these folks?
Well, many people are spending quite a bit now, even on the open market, as it has been put on uneven ground by this administration. Their costs have risen. So right now, Ohio spends, on average, on their Medicaid patients about $5,800 a year. To buy that same type of policy out on the open market, you're going to have a very high deductible and probably spend about $8,000 a year.
Holy smokes. How do you see improvements in that, in the Affordable Care Act?
Some of the things they put in place right when the Affordable Care Act came into place that helped curve the costs down were removed as soon as the Trump administration came in, which is unfortunate. It was actually working quite well to lower costs. I'd like to see some of that reinstated. I'd also like to see drugs, the prescription drugs we all use, put out to bid. If it has a generic competitor, the government has the right to put things out to bid for goods or services, and then you would get a 3-year contract.
And pre-existing conditions, your thoughts on it?
Right now, I think we've all gotten so used to the Affordable Care Act and the expansion, we forget how much it protects. It's not just pre-existing conditions that it protects. It also allows our children to stay on our policies until 26, and it takes off the lifetime cap on insurance benefits. So if a child with childhood cancer, by the time they hit 18, they wouldn't have any money left in the old way we did medicine in the United States.
What other issues do you think will be facing the voters, and they should be voting for you because there's a distinct difference between you and your opponent?
You know, for me, the 2016 election was about people screaming out, working class people screaming out that they're not being heard. And I couldn't agree with them more. Unfortunately, the GOP tax bill took care of the wealthy and the corporations with large tax cuts, which is a lot of the money we need to retrain our workforce and improve our education so that everyone can climb that economic ladder again. So I'm hoping they're still just as angry and they still want more change.
And you're going to give them that change?
Absolutely.
So how many, I have no idea, when you talk about all the counties that are involved in this district, how many different groups do you have to go meet with? I mean, in the old days when it was, the 16th would be Stark, Wayne, and a bit of Holmes, I believe, as I recall.
Right.
I mean, that was fairly easy because it was, it was fairly compact, even though that's not that compact. It's a 60-mile stretch. But this must be how long from top to bottom?
I think my longest drive is about an hour and 40 minutes, and I think all the construction around Akron is making it a little worse. So it's a large geographic area, and poor Summit County is divided into 4 congressional districts. How can the city of Akron get anything done when they're represented by 4 people?
And so you wouldn't agree with the current way things are districted either?
It had nothing to do with the voters and everything to do with maintaining power, which is unfortunate.
And when you talk to people, what type of input are you getting from them? You've talked about the frustration and the wages, obviously some frustration in health care coverage. What else have you seen?
Definitely the top three for me are definitely healthcare, even above wages, which was surprising to me, but people are truly concerned because you never know when you're going to have this unexpected bill. You know, you're out of network, a crazy deductible you weren't expecting, and it can bankrupt the family. There's actually a company in Cleveland that's now offering financing for your deductible.
Financing for the deductible.
It's called Red Apple. It's really a bad.
All that creates is more debt on top of debt.
It's another payday lender type of thing. It's really unfortunate how far we've allowed the healthcare crisis to move in this country, and it's not going to go away by sweeping it under the rug.
Well, Mrs. Palmer, why don't you give the listeners and viewers, look them right in that camera and tell them in 2 minutes why you are the best candidate to win this seat in the 16th Congressional District on November 6th?
Yes.
2018.
You know, I grew up in the Mahoning Valley, so I know what it's like to come out with a really high unemployment rate and climb that ladder, and it's difficult, and I know it's difficult. I have every intention to rebuild that ladder for Americans' working class so your children can climb that ladder again, just like I did, and be successful and happy adults, not in debt.
Thank you. This has been Larry Slagle with another political insight from Massillon Magazine with Susan Moran Palmer, the Democratic candidate for the 16th Congressional District and for U.S. Congress. I'll see you next time.